The charter president of the Lions Club of Entebbe Rd, Fabian Byomuhangi, has highlighted community engagement in healthcare, urging those with goodwill to join the Lions Club for service.
It is important to have a medical camp because we are looking at people, the vulnerable community, who have all sorts of illnesses and ailments, and they do not have the resources to go to get facilities from any hospital because that would cost them money. So Lions Club, as a responsible club, tries to provide the kind of services as you can see on the board, including vision, which I have talked about, in terms of eyesight, including hunger. I have talked about that in terms of providing foods, items, and that kind of stuff. We do diabetes. We have done a lot of screening for diabetes. We have done it already at least twice, one in Endeavour and another one in Kajansi.
Byomuhangi articulated aspirations for growth by welcoming new members while valuing the retention of current ones.
Yeah, we are focusing on everything, anything to do with health. It's a general one. We also deal with mental health. We have got counseling psychologists here. Unfortunately, in this country, people are not taking mental health as a big issue. And yet, according to studies, almost 33% of Uganda's population have a mental health problem in one way or another. And COVID-19 actually made it even worse. When you see domestic violence, when you see young people committing suicide, when you see young people and even grown-ups using drugs, that is actually an indication that there is seriousness in terms of mental health.
He conveyed deep appreciation to the club's development partners and sponsors, recognizing their crucial role in supporting the club's initiatives.
Centenary Bank, Uganda Clays, Action for Health Uganda, Bank of Uganda, if I have not mentioned it. These are partners who know and realize that the kind of work that we are doing is impactful and that it helps people to move on and it gives them hope.
Professor Charles Ibingira, director of Lifeline International Hospital, commended the Lions Club for its commitment to aiding marginalized individuals within the community.
Those who can be treated once and they go home, they will go. Those who need further follow-up, we create appointments. That's why we are at the hospital, and we will ensure that they are properly followed until their cases are resolved. And those who need special care, they are also referred to the hospital, because this is a level 4 hospital. We take care of all specialties.
Byomuhangi, the executive director of the East African Professional Counseling Institute Limited, brought attention to the rising incidence of mental health disorders, emphasizing the pressing need for immediate intervention and support.
So we appeal to the policy makers, we appeal to the parents to always support these children who are struggling with mental health issues. And during our sessions as professionals, as psychologists, we discover that these children have mental health issues that are stemming from home.
The aim of the medical camp was to provide essential services and support to those most in need, embodying the spirit of community service and solidarity. Sudat Kaye, UBC News.